Hi, good afternoon, everybody. My name is Jody Hanson. I'm the Director of Public Affairs and Communication for Johnson County Government. Thanks for joining us. I have with me today Dr. Sami Ariola, who is the Director of Johnson County Department of Health and Environment. We also have Deputy County Manager Maury Thompson, and I thank you both for joining us today. Let's get going right away, Dr. Ariola. I think we have some breaking news about tomorrow's scheduled vaccination clinic.
Thank you, Jody, and good afternoon, everyone. Unfortunately, because of a couple of developments, one, the weather, which is expected to be uh, pretty harsh tomorrow, and the fact that we are having a planned power outage that I know that Maury will be talking about very soon. And because of the population that we are planning to attend to tomorrow, and because of the nature of our vaccines, which has to be maintained at a certain temperature, it becomes necessary, albeit reluctantly, that we have to make the decision to postpone the vaccination event that is scheduled for tomorrow. And so we are sending out email messages to everyone that's scheduled for tomorrow. We have staff that are making phone calls for those that we have their phone numbers here. Again, the event tomorrow is postponed, and it is postponed until next week, Wednesday. And I want to be, I think it's very important, February 24th, Wednesday. If you have an appointment for tomorrow between 9 and 1, please come to the same location, Oakland Fieldhouse, on Wednesday, February 24th, at the same time that you are scheduled to be there. Same location, same time, nothing has changed other than the date. It is possible that that day is not convenient for you, in which case you reach out to us. You can either cancel your appointment and book another appointment when it's open, or you reach out to us. We'll assist you in ensuring that we get you on as quickly as possible. The vaccines are here. The same vaccine that we will have used tomorrow is what we'll use for you on Wednesday. It's also important for you to know that there's no tomorrow. There's nothing, no requirement that you take your second dose precisely on the 21st date from the first dose. According to the Centers for Disease Control and Prevention, CDC, you have up until 42 days from the date of your first dose. So next Wednesday is absolutely okay. We have staff on 913-715-2819 that are available to answer your questions. Of course, you can always email us at jcdhe@jocogov.org if you have any questions. But the event tomorrow has been canceled. It is rescheduled again for February 24, same time, 9 to 1. And we're asking that you come in at the same time that you are scheduled to come. If you have questions, reach out to us. Those numbers are, again, currently showing on the screen. And I would have Maury talk about a little bit more about the weather and the power outage that's prompted some of these decisions.
Great. Thank you, Dr. Ariola. As we all know, we've been facing some brutal temperatures the last few days, and those are projected to continue for the next few days. Due to these extreme temperatures, they've also been affecting our regional power supply. Many of you have likely seen and heard the news today of the rolling emergency electric reductions that have been precipitated because of the extreme weather. Those have affected our local utilities, including Evergy, the primary supplier of electricity to our region. They, among others, have implemented controlled temporary emergency electricity reductions in order to help avoid larger uncontrolled and extended power outages throughout our region. I do have some good news to share that those have ended for the day. I believe they started at about 12:15, but we have been notified that those ended at 1:45 p.m. today. Notice will be provided in advance, is my understanding, if they do need to resume those emergency reductions in the future. For additional information about that situation, I would direct you to Evergy's website, www.evergy.com, for additional information. I also then wanted to reiterate some information that we shared with you all last Friday prior to the cold weekend weather, and that is some assistance that is available to our residents and neighbors who may be needing that. I want to talk about 2 warming centers that are available here in Johnson County. One in the south part of the county is located here in Olathe at 420 West Santa Fe Avenue, and that is one that is provided by the Salvation Army. For telephone contact, you can reach them at 913-780-3640. On screen is their hours, Monday through Friday. The next few days, they'll be open 10 a.m. to 4:30 p.m. Capacity is limited to approximately 8 to 10 individuals, but they do have food available at that location. For folks in the more northern part of the county, the Miriam Community Center is also opening up their doors as a warming center. They're located at 6040 Slater Street in Miriam. Their telephone number is 913-322-5550 if you need to contact them by telephone. You can also find more information at the City of Miriam's webpage regarding that warming center. I will note that they are open Monday through Thursday, so the next few days from 5 a.m. to 9 p.m. Their capacity likewise is limited, but to a little larger number, 20 to 25, they can accommodate there in their lobby and art gallery. I would note that masks and social distancing are required, and they do not have capabilities for pets or animals at that location. For our friends and neighbors who may be in need of more substantive lodging, overnight shelter, we do have a shelter provided by Project 1020 located at 9400 Flum Road in Lenexa. They can be reached by telephone at 219-3347. Their hours are 7 p.m. to 7 a.m. through March 31st. And again, the website is there in case you need to access them in that way. And next, we have a warming bus available at our Mission Transit Center in Mission, Kansas, that's available from 6:30 a.m. until 10:30 a.m. and then again 3:30 to 6 p.m. in the afternoon. Anytime our temperature in the county is below 10 degrees Fahrenheit, those warming buses are provided. I would note the reason for no midday provision of warming buses, there is no service through the Mission Transit Center during the midday, thus we have the limited morning and afternoon hours located there. Finally, I would note 2 other resources that might be of some assistance, and that is the KC Metro Homeless Hotline, telephone number 816-474-4599. And then finally, for those needing assistance from the Mental Health Center and services they may be able to provide, they can be reached at 913-268-0156. Thank you.
Thanks very much for all that information. Very helpful. So thanks for sharing that. Let's go back now to Dr. Ariola. If you wanted to talk a little bit more about the plan for vaccinations this week, that would be great.
Yeah, thank you, Jody. The only planned event that we're canceling or that has changed is tomorrow's. All other plans remain as planned. Wednesday clinic is going to run at Oakland at the same time, 9 to 1. So will the Thursday and the Friday clinic. And again, next week, we're still running these second dose vaccines for mostly 80 plus residents. And of course, now we've added Wednesday. Now, what that will do is push back the additional clinics that we're planning to open up for first doses for the 80 plus group, and you should expect to receive that from us. So the next few weeks is either first or second doses for our 80 plus residents, and the only one that has been impacted by the power outage and the weather is tomorrow's. So again, Wednesday, Thursday, Friday, as well as Tuesday and Wednesday next week will be at the same location, offering a vaccination to our 80 plus residents.
And I know that it will continue to be cold this week. Hopefully we're gonna, after we get past tomorrow, it'll start to get a little bit better. But I guess talk about some of the precautions for people once we get to Wednesday and we are open. It's still going to be cold. So what's some good information for people who might be wondering, should I still come, or what are you doing to help people deal with the cold temperatures?
Yeah. So again, it's not going to be as cold as tomorrow, but it will still be very cold. And like we have said consistently, it is safety first. And the roads sometimes are not quite as good to drive on also. So if for any reason, I got an email from somebody about Wednesday, it's like, I need to drive somebody down, and the road is not we're worried about the weather and the road. And she asked if they can reschedule, and I said absolutely. And so if you for whatever reason don't feel comfortable driving or coming in that cold weather, we would work to reschedule you as soon as possible. And so if you're coming, dress appropriately, but I'll explain all of the different things that we have put in place to ensure that you are protected while you're there. We will have small buses that are basically patrolling the parking lots and picking you up as soon as you exit your vehicle. So look forward to that. Again, we don't want you working in the elements or staying there for too long. And of course, the goal is to get you inside the building as quickly as we can. We ask, of course, that you wear your mask and be appropriately dressed. It's going to be cold. And so physical distancing, wearing masks inside, all of those are going to be required. And if there's a reason to keep people outside for a while, we will have warming buses outside there that are provided graciously by our transit authority here. And that will be there, and we'll have a lot of staff there to assist you, a lot of volunteers there to assist you. And again, it's the second dose. You have seen how the first dose clinic run. They run pretty efficiently. Very important though that you come not longer than 10 minutes from the time of your appointment. These are really fast moving, high throughput clinics. And so if we have people come out of rotation, it changes the calculation. And sometimes we are having upwards of 200 people run through in 30 minutes. So if we have an additional 10, 20 people, it is very disruptive. May not seem like much, but it is. And once you have a bottleneck, a disruption at some point, it has the potential of disrupting for a few hours after that. So there's no need to come early. Come about 10 minutes before your time, and you'll be in and out of the clinic very quickly. So again, dress warmly. We've got resources there. We've got people to assist you to keep the clinic moving, but also to ensure that you are not unnecessarily exposed to the elements. It's a mass vaccination clinic, which means there will be lines. We're just trying to make sure that the lines that we have are inside where you are protected from the elements. So dress appropriately, come close to the time that you have been scheduled. Those are really very well planned and calculated based on the number of persons that we expect to see every 30 minutes. So don't come out of town. Don't come if you don't have an appointment, and don't come anything longer than 10 minutes before your appointment.
That's some good advice there. What can you tell us about this week, plans for vaccinations for 65 plus, whether it's at healthcare systems or pharmacies? What can people expect this week?
Yes. So last week we did give out a few doses, and I say a few deliberately because I know many people want the vaccine, but when we're only able to provide 2,000 here and there, or 500 or 400 in some cases, that's not a whole lot. And so I know that our health systems have been giving out vaccines, and those are expected to continue this week. A few of the pharmacists around here, a handful of them, even though they're only getting a couple of hundred doses, some as few as 100 doses max, are vaccinating also. I know that some are getting their supplies through the smaller capacity clinics. Health Partnership is giving out some, but very small because of storage capacity for the vaccine. And so, again, just additional opportunities. We have starting today, I believe, Hy-Vee and an urban pharmacy have started vaccinating in our independent living facility. So there's just many opportunities to get it. It's not looking like that yet because we just don't have enough vaccine. And if you haven't been called, we just ask that you are patient. I know this weekend we had both Advent Health and KU have clinics where they're vaccinating people. I know that Olathe Health is continuing to vaccinate people. Although small, St. Luke's, I believe last week got vaccine for about 500 people. And Menora got vaccine for about 400 people. Those are going, when you add all of those up, along with what we're able to do, we're chipping away, and that's what we expect to continue this week.
We have a question about why Johnson County is not getting more vaccine. And I know there was a media report, I believe it was last Friday, that Kansas thinks it's, that we're getting, they talked about 90,000 doses, which is, I think, double. So I guess maybe talk about that and when Johnson County might know the impact of that and start seeing more doses.
Right. So I also read the report about the governor expecting 90,000 doses. That would be double what the state has been getting, 45,000. Again, 45,000 doses for over 100 counties. It's not a whole lot. Do I think we should be getting more? Do I want us to get more? Absolutely. But I also know the challenges that they're having in making decisions to split what is a very small pie. So 90,000 is great news. Even more than that is much better news. And so part of me, I have no indication, just totally guesswork that if we're getting this many at 45,000, that is safe for me to assume that I will get double that. I'm sincerely hoping that we do. And what does that mean? It just means that week, double the people 14, 15, 16,000 more people might have the opportunity to get the vaccine into their arms than it would have been this week when we only got about 7,000 doses. So it's welcome news for me. I know that this week, today we were informed that delivery of our vaccine is slightly delayed because of weather. That does not impact any of our clinics this week. It will impact, if it doesn't come on time, it will impact what we're able to do next week, but we expect that to be here. All the vaccines that we need this week, as well as Tuesday and Wednesday next week, are already here. So we're fine. I'm just saying that if we get double what we have now, that's really good news. It's good news for us, for the clinics that we are running. It's good news for our health systems because they have a much larger capacity than they're able to do. It's good news for our other partners, the pharmacists that are ready to dispense vaccines, but just don't have enough, and we don't have enough to split. And so I'm looking forward to that. I'm looking forward to when our state is getting a lot more than 90,000 doses a week, but that would be very, very good news for us.
Dr. Ariola, we're getting a couple questions from healthcare workers or people in phase one saying that they're having trouble getting an appointment. So someone that was in phase one and healthcare worker, what advice do you have for them? What should they be doing this week?
Right, as on our prioritization of phase two, as well as the state's document of the phases, what you will see consistently throughout the phases are that all unvaccinated persons in previous phases to qualify. So if you are a healthcare worker, you qualify. We have been working in healthcare workers throughout. When we open up appointments, we are always pretty clear that it's healthcare workers and 80 plus. And so if you have not been vaccinated, even though, again, to be clear, we've been vaccinating healthcare workers now for over 1.5 months. But if you qualify and you don't see an appointment, reach out to us. Our staff would assist you and walk you in. We are having only a handful of healthcare workers come in these days, and that's okay. So we're not assuming that we're completely done. And there are some healthcare workers who perhaps were hesitant to take it initially and now willing and ready to take it, and that's completely okay. I would say first thing is for you to check our website for when appointments are available. And it's also okay to reach out to us and our staff will assist.
Great. And I'm seeing some questions about healthcare systems. Are they taking names from the health department as far as that interest survey that somebody might have filled out and said who their healthcare system is? Are those names of people who have said, yes, this is my healthcare system? Is that going to the healthcare system, or how are people getting contacted by a healthcare system or getting on a list?
Right. Good question. No, the vaccine interest form that you complete with us is strictly, again, one, primarily for us to make decisions, and two, for us to contact you. The plan with our health systems is I should take a step back. Just looking at our data, one of the questions that we asked is to try to see what percentage of our residents are not affiliated with health systems. And there's not a whole lot of our residents that are not affiliated with health system, which is a good thing. It just means that we have preventive care and we're doing all of those things. But your question is whether we're sharing that we're not. Because the health systems have relationships with the community, because a huge percentage of this population have relationship with the health systems, the plan was not for them to work out of our database. The plan is for them to reach out to those that they've already established relationship with. Now, I know many of them are creating ways for those that don't have relationship with them to indicate a willingness to take vaccine, and then they're picking from those and inviting them. And so, and if you absolutely if you don't have a relationship with them and you don't complete their interest form, it just means that you wait until you can get an appointment through us. We're working down our list. Again, it's not either or. We want you to look at us, our health systems, our pharmacists, and other partners as part of the same pie, and that we are all pushing the vaccine out and vaccinating people as quickly as we can.
And so when you have doses and you're ready, and maybe you're already doing this, but when you were ready to do clinics, your own clinics, so not at the healthcare systems, but your own clinics for 65 plus, and someone has taken the interest survey and indicated they're not associated or affiliated with the healthcare system. So will you be contacting those people for your clinics?
Yes, we will be contacting those people. We'll be working down our list and contacting those people. And again, we chose for this first part of prioritization in phase 2 to focus on our 80 plus group. We feel like we are pretty close. And so after, from next week and the week after, we're going to open up our clinics to ensure that we cover most of our residents, the ones that remain in the 80 plus group. And after that, then we'll completely open it up for 65 plus to do exactly what our health systems are doing. Again, every week when we knock out 7,000 persons in the group, those are 7,000 fewer people that you are competing with, quote unquote, competing with for an opportunity to get vaccinated. And I think we're making progress. And if we, for some reason, get more from the state, that's even better.
We'll hope for that. So just to recap for people that maybe joined late, I just wanted to recap some of the news we had at the front of this event, that because of inclement weather, because of the possibility of rolling power outages that would affect the vaccine storage tomorrow, anybody who had an appointment for tomorrow at Oaken, that has been delayed. And so if you haven't had an appointment for Oaken tomorrow, those have all been rescheduled to Wednesday, February 24th, and you should have been contacted about that. So, and I did see the email that went out, and there's language in there about if whatever, because it's the same time. So if you were supposed to be vaccinated at 10 o'clock tomorrow, it'll be 10 o'clock on the 24th. And if you have a conflict, there's information in the email you should have gotten about how to reschedule. So just wanted to summarize that. Maury or Dr. Ariola, anything else to add?
I will say that if we don't have your email and we have your phone number, we are also reaching out to you with the same information.
Okay.
And again, if you have questions, let us know. But the excellent summary from Jody is tomorrow, the weather is harsh. When combined with the power outage concerns, we are shifting tomorrow's clinic to Wednesday, February 24th. So if you have an appointment, just show up at the same time on Wednesday, February 24th, and you get your vaccination.
Well, I want to thank both of you for being here today and sharing some great information. Thanks to those on Facebook who are watching and engaging with us. Amanda, thanks for being here to provide ASL interpretation. And we will see you tomorrow. Thanks so much and stay warm. Good night.